welcome to a special Journal of Oncology Practice podcast. This is Dr. Nathan Pennell, Consultant Editor for the journal. Readers of the JOP are in for a surprise in January 2016, when the JOP will relaunch in a monthly format with a new look and a number of other changes. Joining me to talk about these changes is Dr. Apar Ganti, Associate Professor of Medicine in the Division of Oncology and Hematology at the University of Nebraska Medical Center. He's also the current chair of the ASCO Education Committee and Associate Editor for the JOP. Welcome, Dr. Ganti.
Thank you for having me.
So, what can our readers expect from the JOP in 2016?
So all along, the JOP has been a journal which focuses on practice patterns, the Journal of Oncology Practice, if you will. Starting in January 2016, we're going to add a new clinical content to the journal as well. So while it will continue to have articles related to practice and practice management, in addition, there will be a lot of articles about the clinical aspects of oncology. So these will be in the form of short, concise reviews, which are designed with the practicing oncologist in mind. So these reviews will be about 2 or 3 pages long and will focus on a particular topic which is relevant to day-to-day practice. For example, one of the first articles would be the management of pancreatic adenocarcinoma and why it is such a challenge to treat. This will be accompanied by 2 editorials, if you will, but these are commentaries on the article from experts in the field. So in short, what the readers will get is a threefer. You will get the main review article and in addition 2 commentaries that would explain and put the findings of the review in context. So the JOP will also have interesting cases reflecting findings that are seen in common cancers but with an uncommon presentation, and there will be a short review of some of the literature, relevant literature for those cases.
I understand there's also going to be a difference between the print and online editions of what readers will see in the JOP. Can you tell us a little bit about that?
Correct. In order to increase the visibility of the journal, the practice management part of the journal will have 2 formats, the print format and the online format. The full article as submitted will be on the online format, but the print format will consist of a short summary which we'll be calling recap, and that recap will consist of what the underlying problem or the question was, what the authors did in the study, the salient features of their results, and a couple of sentences putting it into context for the practice, for the reader. It is similar to what some other journals have already started. The BMJ is a prime example of that. And so the JOP will be initiating a similar format. The entire article will be online, but the print version will contain a summary, a 1-page summary of the article with links to the online content. In addition, there will be about 1 or 2 articles that will be published in their entirety in print. And these would be the most relevant, pressing, high-impact articles in that particular issue. We are very excited about the new format because in the past, the perception was that the JOP was a journal for practice managers. We definitely do not want that to be the case. While it is an important practice management journal, we want it to be useful to the practicing oncologist as well. And I think this would be a wonderful addition and will be of significant use to the practicing oncologist.
Thank you, Dr. Ganti, for joining me today to talk about all these exciting changes coming to the JOP in 2016. I also want to thank our listeners who joined us for this podcast. I look forward to seeing the new changes in the January edition of the JOP. This is Dr. Nathan Pennell for the Journal of Oncology Practice signing off. Thanks for listening.